You're listening to a social justice podcast, an exploration of our world's social issues, brought to you by NES Design and Construction and hosted by Nicola Spurling on the traditional and unceded territories of the Kwikwetlem, Katzie, and Qayqayt peoples. Hello, this is a social justice podcast. I'm your host, Nicola Spurling, and today I'm joined by Wendy Graves for an episode on autism. Wendy, thanks for joining the podcast. Can you introduce yourself briefly?
Yeah, hi. It's nice to be here. As mentioned, I'm Wendy Graves. I'm living in Chilliwack right now. I'm Stolen Nation territories. I am a solo parent to a neurodivergent child as well, and I'm also autistic. And so I was happy to join you today to have a little discussion, and thanks for having me.
Absolutely. And I think at this point in time, people are relatively aware of what autism is. But for those who maybe aren't or who aren't as familiar with what autism is, can you explain a little bit about what that is?
Yeah, so I wouldn't be able to quote the DSM on the sort of medical diagnosis definition, but as far as what sort of research and like sociopolitically we would be considering autism is a often heritable neurological difference. And for some people, there are elements that are disabling. For other people, they may have elements from their autism that they find beneficial. And there's often co-occurring conditions that people experience as well as being autistic. It's a lot more likely that you have another condition as well as being autistic. So, yeah, it's pretty complex for a lot of people. And
Hmm.
it is a little bit sometimes defying definitions as they currently exist. So I often use neurodivergence to describe myself instead of just autistic because it is a lot more complex for me than just the one diagnosis. And it also just kind of stops people from boxing you into a preconceived notion of autism because autism has been so sort of misrepresented in the media over the years.
Right. And that's kind of one of the things that I was told when I was trying to find someone to interview about autism is it's difficult to just talk to one person because everyone's going to have these different experiences. And I hope our audience keeps that in mind as we go through this conversation, that you're going to be talking about your perspective and your knowledge of autism, but that doesn't necessarily mean that everyone who's autistic is going to have the same types of experiences. But with you specifically, how does being autistic shape your daily life, whether that's challenges you face or strengths that you get from that?
I was late diagnosed, so I went through my entire life up to about age 27 with no knowledge of being autistic at all, like not even mentioned, either misdiagnosed or only seen from the mental health perspective from being undiagnosed. And, the distress that can come from being autistic is not necessarily inherently like an autistic trait.
Hmm.
Um, it is often misconstrued as a inherent trait to being autistic, but that as you just mentioned, everybody is so different, and the research has been the research was focused only on one perception of what autism was likely to be. So then the research had been sort of more biased in the beginning of looking into what autism is, and the labels have changed a lot as well over the years. Like the cluster of traits that we refer to as being autistic now has been called like childhood schizophrenia in the past.
Oh,
Uh,
wow.
There is a chance the nomenclature will change again in the future. And that's a part of why some people like using neurodivergence to say they're autistic or whatever, because most of the time you're not going to have somebody who's autistic and nothing else. Um,
Hmm.
and then also it kind of leaves room for the fact that these medical labels will change over time.
Right. And
I sorry.
oh, go for it.
Oh, it was just in info dump mode. So I was just gonna say, so I had like a different experience as a child than somebody who had maybe been diagnosed because we didn't have the right supports, and my behavior was blamed on my personality and character instead of the understanding that it was stemming from unmet support needs.
So I recently went through the process of getting diagnosed with ADHD, and it's a bit more of an accessible process from what I understand. The person who was assessing me said, You should probably get assessed for autism at some point in time. But the barriers seem like they're much higher for that, whether that's the cost or just the process. So I'm curious to know, for you, what was that process of getting diagnosed like, or maybe just what is it like more generally for folks?
So I got really lucky when I was exploring this possibility of being autistic. There was one doctor who is now retired, and that was a child psychiatrist working out of UBC named Dr. Anthony Bailey. And he did one free adult diagnosis a week at that time because he knew how desperately we were in need of them and that there was no way to access them, essentially no way. Unfortunately, that's not available as an option anymore. So, as you mentioned, the process generally for adults would be simply to pay to go be assessed privately. And I don't think you'd be able to get that done for under like $1,500 these days. And it can be upwards of like $3,500.
Mm-hmm.
We're in the situation where I am in, where there is a severe enough impairment associated to being autistic. So in my situation, I have auditory processing disorder. So in terms of how some people can have traits that might be a gift and some people can have traits that are a barrier, I have a working memory that is like way up there, and my like verbal comprehension is less than 3%.
Mm.
Uh,
Okay.
So it's not easy to see that in my verbal interactions, but that's because I have had 37 years of practice overcoming the barrier. And I am also now, as an adult, able to control my environment and schedule important phone calls with a note taker. And I tell the person at the beginning, as I did with you, that if there's anything important, I might not be able to remember it if we're doing a verbal discussion because my brain is working so hard to process it verbally that I just can't remember a darn thing. So, so yeah, gifted in terms of working memory, but then with like such a huge gap between what they would sort of say my baseline or whatever and the hearing, the verbal comprehension, not hearing, but verbal comprehension is 3 deviations past my norm. So that qualified me along with my autism diagnosis to get community living BC services.
Mm-hmm.
But most people who I don't know about most actually, but many people who qualify for an autism diagnosis don't qualify for CLBC because of overly restrictive assessment requirements. You have to have both your autism assessment and basically either a psychoeducational assessment they can use or a psychovocational assessment they can use to assess your global functioning because that has to be impaired enough to qualify at CLBC. So that was life changing to access after all the years of struggling to get by without a diagnosis and without any support. Because even though when my diagnosis was mental health, the symptoms were symptoms, sorry, at the time when I thought it was a mental illness, I would have used the term symptoms. Uh, but now what I understand are autistic traits and sort of trauma behavior on top of that, or it's autistic traits, but then like on top of it, there's like also have ADHD and stuff like that. So that's the exact same trait or symptom set on paper, but for mental health, zero supports for daily living. On the autism side, suddenly there's this whole support system of community living. They do serve some other people as well, but it's pretty much the only support available for autistic adults, and it is very overwhelmed, just like most services in our province and country right now. So
Right. And because it's so overwhelmed, is that why a lot of people will get diagnosed as adults instead of as kids? Or is there some other reason why it takes people a while to get a diagnosis like that?
well, this is a long, complicated question. There is tons of gatekeeping and reasons why people are late to be diagnosed. Just like a lot of things, like cis het white men were the first people to get noticed for all of this stuff. And then, so even people who were more apparently autistic at the time, if they were perceived as girls or women, would often get immediately misdiagnosed as being like just hysterical or like me mentally ill. And then they didn't look into neurological differences as a possibility for the distress. So especially right now, we have this huge wave of women or atypically presenting men, or perhaps people that don't fit into the gender binary who would also maybe not present the way they were looking for autism at first, which was, why aren't these cishet white men working the way I want them to work? And then it has expanded from there. And then any other community, as you get more intersectional and less privileged, there's more barriers. So assessments won't cross culture very easily. And if you are not financially privileged enough to be able to put that money out or qualify for a loan or find some type of service provider to pay for the assessment, then that's another reason why people aren't getting assessed. There's other reasons too, like the assessment process itself is difficult. You have to be able to get to the doctor, go there, sit there, do these assessments without having meltdowns, or perhaps having meltdowns, but having doctors who are understanding and, will work through that with you, right? I had to split mine up into several days. I had to use Work BC to get the psychovocational side of my assessment done, because although I had my autism assessment, I didn't have a global functioning assessment. So I need that to qualify for CLBC to get supports for work. So yeah, so there are a lot of barriers, and that's just talking about adults. For children, those same stigmas exist in terms of like the intersectional considerations. And then there's also the fact that the province heavily, heavily, heavily gatekeeps the autism diagnosis. So
Mm,
there's a central location that they tend to put children through on the mainland side called Sunny Hill, and then there's a different system on Vancouver Island, but people will wait years to be assessed by these doctors, and some of them are just terrible at their job. They are using very outdated metrics. They are using things that we now know to be sort of myths or stereotypes that are not true. Like, they're not using the right assessment scales. Or and what will happen is that the child who is definitely autistic is getting sent out with what we call an alphabet soup diagnosis. So, oh, they have ADD and ODD and SPD, and it's not even good medicine, because in medicine, if one condition can explain everything, it's the one condition. It is not the 10 other conditions.
right.
So they are not following that for some reason at Sunny Hill. And that's where you get into this political discussions. Well, why are they gatekeeping it? Well, it's because there's money involved. As soon as the child gets the diagnosis, they qualify for financial support through the autism funding unit to support their needs, and that's expensive. They don't want to do it. They're trying to phase it out because of the cost and other reasons, but that's one of the things that has made a huge difference for families raising autistic children in this province, has been that funding unit to just equalize the playing field a bit from the discrimination that our kids are facing in every aspect of their life, trying to get into daycares and schools and after school clubs that are not made for them, that are inaccessible. Like, I use a wheelchair part-time. I can't even get into my kids' building at school because they let the accessible parking spots get completely blocked in by the through lane and the pickup lane. So, there's just so many barriers to taking part in every aspect of living in a community for us. So not having the autism funding unit available to us would be very detrimental, and I hope that they reverse course on that decision, but we shall see.
Hmm. And what are some misconceptions or stereotypes? You talked about how those are being used in that assessment process, but what are some of those common misconceptions or stereotypes about autistic people that come up?
We'll get assessors say things like, "Oh, they made good eye contact, so they're not autistic."
Mm,
Or, "Oh, they lied, they are not autistic," or "They used imaginary play, they're not autistic," and none of those things are tenets of being autistic at all.
right.
So, it's really difficult, and then, people gone, and the other thing is that once you've had that assessment done, even if it's not at Sunny Hill, even if it was just by a different, like, unqualified assessor or whatever, you can't even just go to a different doctor to get a proper assessment. You have to then wait, I think it's either a year or 2 more years before they will consider a new assessment.
Oh, wow.
So they really make it impossible, and I got lucky when my daughter was on the wait list for Sunny Hill, which I, at the time I thought was going to be our only option because we're low income, their Variety Children's Charity uh, got a donation and was able to offer paying for private assessments for some people. So I was able to use that track along with the infant development center, the child development center, and get the reports that I needed to be able to get a diagnosis for my child. And I felt really lucky because I just knew how unreliable using Sunny Hill was, and so that is still available to some families to in some manner, but I think only for young children, whereas it originally was for children of any age. So they've had to scale it back a little bit, but um, there are sometimes options as well. Like, but you have to, you know, families are gonna have to resource hunt a lot of the time to be able to find ways. Like sometimes there's grants you can apply for, but that's all work that parents who are trying to parent their likely to be autistic, undiagnosed children with no support. The last thing that they have time to do is go researching and filling out grant applications to get the medical care for their child that they need, that they should just have a right to.
Right. And you used the term neurodiversity previously as a way of encompassing autism as well as other mental health, I guess, experiences, you might say. Can you explain what neurodiversity means as a concept?
Okay, so neurodiversity is meant to refer to groups of people who are both neurotypical and neurodivergent. So it is I don't want to say unfortunately because I'm not really here to rag on anybody who's just misusing it. The reason that there is a bit of a contention about how these three words are getting used, and I'll tell you the three words in second, neurodiversity is one of them, is because they're being co-opted by people who should not be using the terms at all. So,
Mm,
but so neurodiversity was always meant to refer to the state of the earth. We are neurodiverse. The earth has neurodiversity. There's never been a time where there was only one neurotype on the earth. So it's a socio-political term because most of these conditions have been made medical and then brought into socio-political discussions. So neurodiversity means diverse groups, including all neurotypes. Neurodivergent, I
mm,
got myself, I'm neurodivergent because I am not in what society has dubbed the neurotypical mindset.
right. Okay. Okay.
So neurodivergence or neurodivergences, those are the conditions themselves. So I'm neurodivergent. I have a neurodivergence. My neurodivergence is autism, or I have neurodivergences. I'm autistic. I have ADHD. I
Hmm.
have PTSD. So essentially, neurodivergent is meant to refer to anybody outside of that typically most average development, that no anxiety, no depression, no clinical anxiety, no clinical depression, right? And so um they are socio-political terms. There is no like diagnosis in a book of neurodivergent. But I just find it a more useful language to use to talk about all of this stuff.
Okay. And I guess neurospicy is also a term that comes up. Is that something that you would use or see used quite often?
I like it. It's used a lot, yeah. And however people want to kind of refer to themselves, it's important to like honor that self-expression for sure. So neurospicy, I like it. Not everybody is gonna like any of these terms, right? Where like you said at the very beginning, autistic people are people, neurodivergent people are people. So we are all different. There is going to be zero chance of getting us all to agree on any one single thing because we're not automatons. We're people. So there are important historical reasons why people coined those phrases and those words rather. So if people are curious, it's good to Google Judy Singer and Cassian. I cannot remember Cassian's last name, but it's good information for if people are curious to Google the origins of those terms and why they came about. And yeah, so it's been quite a journey. Um, I actually didn't even know I was like autistic. As I said, I had been sort of diagnosed or misdiagnosed with mental health conditions And I had foster children, and I was talking to my oldest child, my eldest daughter, Emily, about what I was experiencing with my mental health. And she said, but like, Wendy, that sounds like autism. That sounds like what I have and live with every day. And what? What do you mean? Like, what are you talking about? And I had actually been to university and taken child development psychology. And I was like, okay, so there's got to be something in my textbook. I still have it on the shelf. I pulled it out. Autism was half of the page only.
Huh.
Did not believe it. I was like, how did I go through child development psychology and only half a page is on autism, right? So, but this was a few years ago, so I don't think that would be the case anymore. I think there would be more knowledge. And um, sure enough, it was okay. This might be worth looking into. And then so I became one of those, people of sort of feminine person and had been missed and misdiagnosed with just mental health conditions. Like, even if, my mental health was poor at that time, and maybe I sort of did have a lot of the things going on that are in common with the diagnoses that I had, which very common misdiagnoses for people who are autistic and like feminine presenting, or who are women, or who are so atypical, like men that are typically, sorry, men who present atypically, or like I said, people who are just outside of the gender binary. So those stigmatized gender roles for autism, like, they don't really exist. They were just sort of making it up as they went along and assuming that, oh, autistic boys act this way, autistic girls act this way. And it's obviously not going to be like that at all. So they're expanding all of that, and they do change things quite often in that world. So then I started trying to figure out how to get diagnosed and joining lots of groups, and my whole life changed. And a lot of the mental distress that I was in on a daily basis began to lift as I understood what I was experiencing and why it was so hard trying to live life as if I was not that. And
Right.
so it's been quite a journey since then. About 10.
Hmm. Speaking of neurodiversity, we talked before this podcast about the neurodiversity paradigm, and I'm wondering if you can go over the core ideas or tenets of the neurodiversity paradigm.
Yeah, so as far as I can remember, and it's been a long time since I first read all of that, but the term was coined, as I sort of mentioned briefly, because when autism was first being researched, it was really only researched from one angle, and that was to eliminate it. Um, the the same doctor who invented conversion therapy, which is now banned here, I believe, invented what used to be considered the gold standard of therapy for autistic kids, and that's applied behavioral analysis, ABA. And it was all about what they were coming from, this concept that they didn't believe like autistic people were even fully human inside, and that we needed to
Mhm.
have like humanity instilled within us, and that we were sort of these blank slates that needed to be sort of essentially dog training. Very similar behaviorism to dog training. It is very dehumanizing, to be honest. Like, especially at the beginning of when they first started doing less therapy, I use that term loosely.
Mhm.
So the neurodiversity paradigm came about to sort of suggest, like, we all belong here. Like, autism has been here all along. It's only in these sort of rigid medical paradigms that there is this imaginary gold standard of existence that autistic people or people with ADHD are not living up to. That's the typical neurotypical versus neurodivergent. So it is, as I said, like a socio-political term, but I do believe anthropologically that it is correct. We've never just had sort of one type of way of thinking on Earth, and we never will.
Hmm. I mentioned this at the beginning, but there's that term. If you've met one autistic person, you've met one autistic person. What does that mean to you to hear that?
I mean, if you've met one holistic person, you've met one holistic person.
Hmm.
But I just say autistic people are people. So you're gonna find amazing autistic people, and you're gonna find assholes who are autistic, because it's the same from real. real life. It's just not real life. It's the same for any other person who is a person. We are all different.
Right.
I'm perfect, and then an asshole 2 hours later. That's just, or I should say other things. I guess, bleep that out. You can, we're going to meet people at every, journey of their life who are autistic because we're just people. So yeah, that's sort of where that phrase comes from. There are shared experiences that we have, but a lot of the time it's not because we're affected the same way by our autism exactly, but it's because the experience of being autistic in this society or marginalized in this society will bring about predictable things like, discrimination and being marginalized for being different and being persecuted for those differences, having your differences medicalized and then pathologized. And then they try and, in the past, give you inappropriate medications and inappropriate therapy to try to get you to seem less divergent and more average or more typical. So
Mm-hmm.
the lens change from that school of thinking to what we refer to in sort of my circle of friends and my peers and my, professional colleagues as neuro-affirming care. So we're not, the neurodiversity paradigm never meant that we're all perfect and nobody should ever have to change anything about themselves. Of course not. You wouldn't say that about any other person either. What it means is that if we need medical care, if we need a therapy, occupational therapy, speech therapy, if we need counseling to support our emotional regulation, that those therapies or that counseling or those medical appointments are made with us in mind from the beginning, not retrofitted in after. And that's true for so many other things too, because that's a part of why I'm so involved with trying to learn more about like anti-oppression. Because at first I, was just talking about being neuro-affirming because, me expanding my experiences. So I had always been sort of one to volunteer with marginalized groups. I've always had that sort of equitable mindset as a part of who I am. And so I immediately wanted to go to work advocating about the unmet needs of neurodivergent people. And then as you go along and you're sort of supporting all of these different, what seem at first to be isolated, marginalized groups, it becomes clear, very evident they are all connected, and the topics that you've recently been discussing on the podcast very similarly are so connected. And that's why I am trying to learn a lot more about anti-oppression values now, because they include sort of advocating for unmet needs for neurodivergent people, but they also include all the other things that I've talked about that make it hard. If you are a marginalized gender, if you are low income, if you are racialized, they just add layers and layers of barriers to all of these things that we've been discussing. So the socio-political terms, neurodiversity, neurodivergent, neurodivergence, they are useful in these discussions about anti-oppression and disability rights. So
Right. Yeah. And I think obviously those terms are useful. And at the same time, you're going to have people that hear a term like that and they want to put that group of people in a box. They want to say, okay, autistic people all behave this way, or it could apply to any group of people. And so I'm curious to know how the intersections with race, gender, class, neurodiversity, how all of those intersect. And so, with this conversation being about autism, how does being autistic intersect with all of those other factors?
so in terms of these different topics that we were discussing, it's interconnected in the sense of, again, an anti-oppression lens. So originally, autistic behaviors were completely pathologized, and a lot of the other marginalized groups that we've sort of touched on or people might be thinking of right now, they similarly would be experiencing, pathologization of their behavior because it's different to a social norm, not because it's actually a problem.
Right.
Um, then that is compounded if you are or if you are lacking privilege in other areas. So if you are low income, you cannot go to pay for a private autism assessment.
Hmm.
You are disabled. Like for me right now, if I was trying to go to doctor's appointments, like I could not go if they were on a second floor without an elevator. I could not go if there is not parking close enough because my wheelchair van is being fixed. So I would need to have parking that was very, very close. Otherwise I would not be able to get there. I was went through a period of time where I wouldn't even have been able to go to those types of doctor's appointments without a support worker with me. I didn't qualify for support workers before I had my autism diagnosis. So how would I get to the appointment to be able to get the diagnosis? So, and it just goes on from there. If you, if any person was listening to racialized people discuss their experiences in the medical system, those communities have hugely specific barriers to accessing medical care. Like they would not have created the tests for testing autistic people with other cultures in mind. Generally, that's the same reason why IQ tests are so suspect a lot of the time, because they are questions that are, is this person intelligent within this very specific social norm setting? And it's really only testing one specific type of intelligence.
Hmm.
So, though, and that's why diversity is so important in all of this, in all of research, in every stage of being in a community. We need the diversity of people, of minds, of intersections, because otherwise the bias is there towards whatever group is dominant. Like, you know, it's been expressed to me a few times that even the groups that I've tried to volunteer to admin, that it isn't a safe space for racialized people. And I think that even if I had been more educated than I was when I started volunteering, I'm still white. Like, so there is never going to be a way that I can perfectly assure safety, because I will never have the lived experience education of that community, that marginalized community that needs their own sort of space and advocacy. They need their own space and advocacy and have unmet needs that I would never be able to think of because I'm not in that community. So
Right.
that's how everything is connected in terms of the anti-oppression. That things there's just no way to not be connected on those levels.
Hmm. And how do you think autistic people are represented or misrepresented in media or education or healthcare? Are there ways that they're represented, I guess, in a positive way and a negative way? I'm assuming there are, but what are you seeing there?
So just like a lot of other disability communities that advocate about representation, we have stereotypes, we have flat out incorrect information that gets passed around. We have organizations that want to exploit us for financial reasons, especially sort of like the care industry, even nonprofits and stuff like that. Like a lot of people are willing to say they're trying to do something good for us and they're not. Um, and Sorry, what was even the question?
So it's about how autistic people are represented or misrepresented in media, education, or healthcare.
Right. So, and then we also have the same situation where we are only being represented in like TV shows and stuff in specific ways. There's a lot of infantilization that goes on, a lot of making it seem like autistic people are always childish, or they only want to represent autistic people who also have certain other co-occurring conditions, which pigeonholes everybody. And we also have a lot of, representation that it would be sort of what the disability community refers to as inspiration porn, where it's like, oh, look at like this autistic person. And really, at the end of the day, it's about making people feel better for not being autistic and putting
Mm,
us in this sort of role, this unequitable role, like a pet to be pitied. It's not equitable at all. And a lot of the time, we don't have that equitable representation because they don't want that view of like autism being out there, and other disability communities deal with similar. I know I follow Open Future Learning on Facebook and some other, disability advocacy pages or comic comedians and stuff. And it's the same thing. They don't want anybody that is going to challenge that childlike, whimsical view of being autistic that they have on all of these shows that have autistic people in them now, like Love on the Spectrum, The Good Doctor, and it's all like most of the time it's a cishet white man leading the role, Sheldon Cooper, and
Mm,
and so it is unfortunate because that's our representation, which is kind of good, but then they're representing it with stereotypes, which sucks. And
right.
and I'm sure other marginalized communities would say very similar. It's hard to I'm sure it's hard to showcase the diversity of people, right? Marketing is marketing. So is it going to sell or is it not? It's tricky, right? And so those things all do sort of cloud the view of what like autism really is. And then you have the further barriers of wanting to keep it pathologized and medicalized. There's quite a large subset of people who are against the neurodiversity paradigm because they are misconstruing it as us trying to say that autistic people don't, never need anything to change themselves. Well, it's just patently not true. We would never try to say that because that's dehumanizing. We
Hmm.
all want to achieve what our like level of personal growth is. I've never met anybody who didn't want to grow as a person, right? Um, it's the fear that sort of humanizing this disabled person and saying that autism is not something that we need to get rid of might cause them to lose support. Maybe you need to have this off the record, but I'll just say it and you can decide. I am only involved in online discussions for being trans because I don't live I'm not out or anything like that. But do you know how where there's like, okay, well, being trans is not a mental like illness. So there was the push to take it out of the DSM in that section.
Yep.
But then I have been hearing from people in the States that it has caused them to lose supports that used to be in place when it was considered that.
Right. Okay.
Never easy. And I don't want to necessarily make that on camera. So if there's any way that you can think of to sort of put a phrasing in here of that or whatever, or if we can do a soundbite later, let me know. But
Hmm.
so changing anything in a policy way is always a risk for some of the members of that community.
Hmm.
Change is just very difficult. So it can be difficult to get people on the same page. And as I said, a lot of people just won't be. We're all so very different. But it's difficult to get people to understand that even though we're trying to say with the neurodiversity paradigm that we belong here, it doesn't mean we're trying to say, and there's no reason to have support. They're not trying to say, and there's no reason to see the doctor if there's a problem. But for
Right.
some reason, people seem to think that's what we're trying to say. Or they want people to believe that's what we're trying to say because they want to discredit the neurodiversity paradigm for whatever reason. Either they don't agree with it or they don't understand it or they're afraid. It's different for everybody.
Right. So if we use that trans analogy, it would be we're not saying that being trans means that you have some sort of, I guess, clinical mental um, issue, but it does mean that you still need to have treatment for that because that's, and I guess that's also, I don't quite know how to frame that either, but I guess that's also why gender dysphoria is included, whereas being trans isn't, because you can be trans without having gender dysphoria that needs that medical treatment. So it's a
100%.
really,
Sorry, if I can I'll just spin off of that. That's sort of exactly it's where I was saying, nomenclature does change. So that is exactly it. They didn't say just being trans on its own means that you're mentally ill. They did say, but there is a specific experience that trans people may have that is clinically needing support. And they should have probably also said, and the experience of being trans is so mentally distressing in the society that we will still pay for whatever it was that was being paid for supports that maybe were lost. Because obviously those people should not have lost any support with policy nomenclature change, right? So
hmm.
I
And
think,
that is that a question of the policy being the problem or the DSM-5 being the problem, right? Like that's
and it's totally both because the
mhm,
policy based on the DSM, and the DSM often is pathologizing quite normal human behavior. So it's tricky because there is a chance that if some of these things were taken out of the DSM, that people would lose access to certain things. And so
Mhm.
maybe we don't want that, which, and that's a societal thing. Again, that's where the socio-political comes in, because if we're saying we're only going to support people with this specific diagnosis, it's totally inappropriate. Look at my example. I needed those supports, whether the tick box was in autism or in a mental health condition. So there is some, people posit, and there could be a change where it's like, okay, yes, we recognize that for a lot of people, autism is this sort of heritable condition. In and of itself, it may not need to be considered a medical diagnosis. But if there is impairments because of that, then they would then be supported, because then it would be considered sort of what they refer to as autism spectrum disorder.
Right.
So that, and that might be tricky, because yes, if some people are assessed to be, yeah, okay, well, yeah, we are saying you're autistic, but we're not saying that you are in any sort of need of support. That's back to square one, right? So um we are doing well in some areas, like work. BC is not diagnosis dependent. Applying for CPP and the disability tax credit also are not diagnosis dependent. You need a doctor to sign the forms and say, yes, this person is impaired. There does not have to be diagnosis to get those. And that needs to be way more widespread. A-
Right.
And same with gender care and stuff like that in the States, having a dual diagnosis of autism and then coming out and saying that, or not a diagnosis of being trans. Sorry. If you are autistic and then you also come out as saying that you're trans, there is unfortunately people in the States who are trying to say, no, you're not trans, you're not accessing these supports, you're just autistic and confused.
Right. So
There,
taking that autonomy away from people who are autistic and saying you can't think for yourself, basically.
and so while we might be slightly, and I use that term slightly, ahead of the States right now, it's always a huge fear that we will just slide right into the same problems that we're seeing in the States with huge discrimination. Track 2 Made is right on that, where, we need to be really safeguarding this, and we're not. And autistic, disabled people are, this is it's a dark turn to bring up, but it is just the case that right now, with the global rise of fascism, capitalism will always put people with disabilities in second tier citizenship, and it's just not appropriate. It's not okay. All of our potential as people is getting squandered, and the amount of time that I have to waste doing paperwork just to access these supports, instead of playing with my kid and being with her, and you know taking part in community events, because I'm just so overwhelmed with all of the tasks that I have to do for being disabled. you
Mhm.
know I have energy disability, so there's a chance that I could work if I wasn't expending all of my energy on this bureaucracy. But by
Right.
the time I'm finished, I've been going to all of these appointments and getting all of these assessments for years for myself and my child. And I am so burnt out, and I'm so exhausted. And it is just wrong. I shouldn't have to be jumping through any of these hoops. I should not have to go to my kid's school and not be able to get my wheelchair out of my car to pick her up on the playground, because it is so overwhelming or inaccessible to people with disabilities, because we are already marginalized. And then that is a social opportunity at the end of every day that has been taken away from us, because
Right.
I can't just go and sit on the playground with my kid and meet the other kids and parents.
Mhm.
So, the meaningful inclusion of all of these marginalized voices and neurodivergent people, like, really needs to be kicked up a notch right now. And it's hard because people are so tired and so weary from global events, but it's now more than ever that we need to, like, stand together as marginalized people and communities. So, yeah.
Right. And so what do you think genuine inclusion and accessibility actually looks like in practice?
Well, we have standards of universal design. So we do know what this looks like for a lot of people. There's been a lot of research done into it. It's money. It always comes down to money.
Mhm.
Oh, there's not a lot of parking spots, so they don't have the parking spots big enough for wheelchair ramps that come out of the side. but I also can't use a back ramp because that would block the parents' through lane. And so anytime that and it needs to be from the bottom up, like the experiences that I've had with my child in school this past year, it's just so goes to show there is no way to retrofit disabled people into society. It needs to be broken down and started from the ground up with accessibility in mind.
Mm,
Like, they refer to it as the curb cut effect. Like, nobody is impaired by a ramp except capitalists who want that space. So put those stairs there so I can build something else instead of a ramp.
mm,
And that is my life every single day when I try to shop, when I try to take my kid to school, when I try to go to parks, when I try to go to civic events, doctor's appointments. It is I have to add hours and hours and hours of reconnaissance just to find out whether the parking lot's accessible because that information is not even um accurate if you try and find it online. So and these are things that I myself have learned from disability advocates who are already saying what needs to be done and being ignored. So it's tough.
right. And bringing the conversation back to autism more specifically, what is something that you wish more people understood about autistic people?
That we're super sexy, fun, and awesome, hilarious.
Amazing.
I just honestly, it's like I was raised in this world. I know how ableist it is because before I was on the side of the world that would be calling themselves disabled, I didn't know any of this stuff. I was just as ignorant as, and I use that term ignorance because ignorance can be alleviated through learning. I'm not trying to denigrate anybody. I was ignorant of these facts at the time. Of course I was. They don't teach this stuff in school, and they should. The issues in the parking lot are an amazing learning opportunity. My daughter has to live through it so her peers can learn it too. Why not? It's engineering, it's physics,
Hmm.
it's accessibility, that's, social studies, that's career planning, that's all sorts of things. Like, there's no reason why kids can't also be involved in figuring out how to make things like accessible, right? And we're fun and, trust me, you want us at the party.
Absolutely. And has being autistic given you any sort of unique perspectives, insights, or gifts? And I don't mean that in the sense of, oh, this person is autistic and therefore they must be gifted, but just in terms of a benefit to your life, perhaps, and like I said, those unique perspectives or insights that you've gained from it.
Becoming disabled is obviously a double-edged sword because I have a whole bunch of barriers that nobody wants to face barriers. Like, I'm not a glutton for that type of punishment. But I am also so thankful to not be so ignorant anymore. It's difficult to be really self-aware in the world right now, but I wouldn't want to be anything else. I wouldn't want to be the person I was pretending to be because I thought it would bring me success. I
Mm,
never really liked that person anyway. And it didn't bring me any success, it just brought me heartache and trauma. So, um, I would say that, like, it's always been a bit of a gift. I don't think that I would have been justice-oriented as a child, even if I was imperfect at it, obviously, as a child, but, I believed everybody deserved to be treated equitably and well, even if I didn't have the language or I wasn't, like, living it because, as a kid, you just do what your parents and your social community does. So, I'm grateful that in a way that I had a chance to unlearn all of that. And I have to admit that I'm hyperlexic, so taught myself how to read, and my child has the same condition. It is not without, like, oftentimes if there's something that people would refer to as a gift, there's something that my brain or body had to give up for that gift. So
right.
being hyperlexic is a bit of a gift in a text-oriented world where it's the same language that I was exposed to when I taught myself how to read. But increasingly, the rules that I sort of learned reading and grammar and communication under are changing. Linguistics changes so fast and things like that. So it was a bit of a bonus at the time in school to be hyperlexic. But if the reason that I'm hyperlexic also meant that I have this hearing problem, well, that's not really a gift to me. That's a huge barrier.
Right.
Every time like I message somebody on their website or do a contact form or send an email and all I get back is call me at this number. And it's like, Do you think I do not know that phones exist? Because why would I email you when your phone number was literally right next to the email me button if I
Mhm.
want to talk to you on the phone? And those types of things. And I totally might have done the exact same thing before I understood that I was disabled because that's just what you do. I don't want to type all that out. Just give me a quick call. But that's what ableism is. You don't need to understand you're doing it to be committing the ableism. It's the same as racism, sexism, ageism. You don't need to do it purposefully to be doing it.
Right.
It's tough because advocating sounds so much like complaining to so many people. And it's like you have to almost create a relationship with that person to get them to not see what you're saying as just complaining. And
Mhm.
it's hard. I don't want to be seen as just a, triggered Karen when I'm trying to advocate for myself or my child. But if I don't, we don't get to leave the house. So I don't really have a choice. And it's so triggering to have to advocate. And then there's just no way to not be in fight or flight mode when every single day I'm fighting just to get into the building. Not even into the building, just to the outside courtyard playground, and I can't even find a way to safely do it right now. And, so again, it's just the most marginalized people are having to do the most extra work to access something so basic like public school.
Right. And I obviously that's a really important point to bring up, and I also really appreciated you mentioning that gift piece and how you might see a gift on one side, but maybe it's something else that's being sacrificed on the other side of things. And I've noticed that with ADHD as an example, and you get this what you might consider a gift of being able to hyper focus on things for periods of time and get lots done. And then you crash for a couple days and you're not getting anything done. Is that really a gift if you're getting that sort of that negative impact on the other side of things? And we've talked a lot about autism, about disability more generally, accessibility, and the neurodiversity paradigm. Are there any other subjects that we haven't talked about at this point that you think would be really important to bring up?
I mean, I think that we've touched briefly upon most things that are the forefront of what is discussed in groups when you're in groups for other neurodivergent people. And each thing that we've talked about, I'm sure you could do a whole another episode with somebody on it because it's so deep. Everything that what a so-called neurotypical person would have to be dealing with in life, budgeting, housing crisis, um, finding work with benefits, maybe trying to find union work if that's what's important to you. Those things are all that much more out of reach for autistic people, especially if they have other marginalizing intersections that they're trying to navigate life through. So, I think really that's most of it. I can't think of anything that glaring that I've left out other than, I really want to stress that if any person is navigating, being neurodivergent or raising a neurodivergent person or being a part of their care team, to look into what's like truly neuroaffirming care because it really does change everything. So an example of neuroaffirming care that the public might be used to seeing in BC is that Life Labs. They did sort of run like an autism program through Life Labs, and you can make requests for different, accessibility considerations, and I remember at that time, I was able to lie down for my blood work instead of having to sit up because um, similarly to most of us, have a co-occurring condition called, well, most of us have co-occurring conditions. One of my specific co-occurring conditions is called Ehlers-Danlos syndrome or Ehlers-Danlos syndrome. I'm hypermobile and double jointed, and most of my joints are loose, and it's sort of loose joints and connective tissue, a collagen disorder. So um, that's an example of neuroaffirming care. I'm not trying to say I don't need the blood work. I'm trying to say I need the blood work in a way that I'm not going to faint from my what's called POTS. Is a dysautonomic function. So the adrenaline rush from not liking getting my blood drawn puts me into such fight or flight that I actually can faint just trying to have the blood work done or my EV put in. And I remember one time I was in the hospital and it was an emergency situation. They were trying to put an IV in and I almost fainted. And the nurse who, I know nurses are overworked, but boy, was she not nice to me about the fact that I was fainting. And
Ooh.
another nicer nurse just kind of came and stuck my head between my legs and said, "It'll be okay." And that did stop me from fainting completely. So just completely different examples of care. One sort of the tough love approach, perhaps, that was not at all appropriate. And then another that was sort of more neuroaffirming, even though I didn't know I was autistic at the time. This nurse could clearly see I was in distress. And all I needed was for somebody to say, bend down and let the blood come back to your head. Right. So
Mhm.
it makes a huge difference. If these terms are so new in use, we do have service providers that will use these terms and not actually be neuroaffirming. But there are some checklists, and if people start getting into this world and looking into neuroaffirming care, like say on Facebook, on social media, you will start to see in your algorithm service providers like speech therapists, occupational therapists, counselors who work from a neuroaffirming lens. And that is that autistic people, people with ADHD, we all deserve to be here. The world is a neurodiverse place. And that means that I might need to adjust my clinical setting or the way that I approach things. I might need to consider a person's sensory needs instead of just chiding them for being overwhelmed in the bright lights, right? It's and 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 it's hard. Change is hard for sure, but it took me from being somebody who I was in such distress. I was being misdiagnosed with bipolar disorder, borderline personality disorder, generalized anxiety disorder, depression. Like I had that alphabet soup going on. I
Right.
was medicated. I'm not anti-medication, but again, I needed appropriate medication, not the medications that I was being prescribed. And I could not work. I was unstable. I was drinking alcohol a lot and whatever else and smoking cigarettes. And now I've been able to let go of all of those vices because my body is not constantly in both physical and emotional distress. I still deal with a lot of chronic illness and other barriers because of my physical disability. But in terms of the stuff that used to distress me about being autistic, it is so much alleviated because I just don't listen to anything that is based on that other lens. That autism is a problem that needs curing and therapy just to be not autistic.
Mhm.
I am not in that world anymore. I am in the world of you deserve to be here. This is how your mind is working. This is a great way to accommodate the fact that this is how your mind and body is working to reach your own potential, whatever that may be from your point of view. And I now have been able to access proper care. I've learned that I'm hypermobile. So, things like I was doing physical therapy after a car accident. And because of the pain that I was in and my body trying to heal, all my autism stuff went like into overdrive. And that was sort of the beginning of the real barriers for me because I was trying to go into the gym and I had worked in a gym before. So I know it previously had not been a problem in that environment. And the very minor exercises that they were trying to have me do were so excruciatingly painful that it was sending me into autism, what people would refer to as sort of like autistic meltdowns, but it wasn't. It was a pain meltdown, but I probably wouldn't have had the meltdown from the pain if I hadn't been autistic.
Right.
So it's these are all the ways. So, but nobody would have focused on that. They were focusing on behavior, not the pain.
Right.
They didn't say, well, you're in a lot of pain. It's understandable that your sensory system is in overdrive and can't handle the noise and the bright lights and the exercise that you're trying to do. But that didn't come to me at that time. You gotta push through it, and I was just hurting myself more and more. Sort of started sort of autoimmunity and stuff that I now have to deal with. So it's really important that autistic people are not forced beyond what they are telling you is their limit, like ever. Not the way parents think that they need to do it for children. Like, no, they need radical acceptance that this is exactly where they're at and this is where it's going to be accommodated because it's not easy to move forward from any stage of life if you don't get to experience that stage first.
Right.
So there's sometimes people try and refer to people who have conditions like ADHD or autism as like this delayed emotional age. Oh, they're 16, but they are 7 inside or whatever. It's like that's all sort of language that we could maybe optimize. And I do believe that neurodivergent people often need longer to reach the same milestones as neurotypical people. But from what I'm seeing, a lot of the time it's because either there's a co-occurring condition or very simply that family has not been able to access social situations for the child to be able to progress social emotionally. And it's the same for adults. If you don't happen to be an adult who comes from a privileged life with a stable family and stable finances, with your medical and neurodivergent needs met, you don't just magically grow older and those problems go away. You
Hmm.
know, I talk a lot about, because a lot of people who are getting diagnosed with autism and ADHD now had parents who went through their entire lives with the same conditions and no diagnoses,
Right.
but they dealt with it through, like smoking cigarettes. Nicotine is a stimulant. So a lot of people who could smoke at work were fine, and then as soon as you couldn't smoke at work, huge problems regulating. And
Mm.
have known necessarily that it's because, oh well, you have ADHD and the smoking was a self-medicating for you. People don't know that. And so there is often an almost like a generational trauma as well that we have to heal as a family unit, or if you're not lucky enough to do it with your family, you have to try and do it on your own. And it doesn't go away with just therapy. People need to experience that co-regulation that they did not get as a child if it's been missing. So for me, I know like things that I didn't get to experience as a child in the same way as everybody else because perhaps I couldn't go to as many social events because, say, my mom needed to be able to handle that social event plus my sister and my brother and me. So maybe we didn't go, right? And so that's another thing where, well, that means that I need like 10 times as many social experiences in my adult years before I reach the same level that my same age peers were already at because I don't have the experiences to be able to do it.
Hmm.
A lot of the time in the different groups that I'm in online, people have brought up sort of a big sibling, like, big brothers, big sisters, but like for adults. And I think it's a really good idea, especially as I was sort of mentioning right now, the world is sort of tough for everybody. And it's the exact right time to, instead of what the pulling up the ladder and being like, well, I don't have, resources or time or energy for, community connections or helping people who are in a worse situation than me. We need to be doing that twice as much right now.
Right.
And and that's just the case.
Hmm. And you mentioned this at the beginning when you started answering this question, the fact that we could really start digging into all of the topics that we've talked about as their own independent episodes because there's so much to talk about. And I think this is an issue that we run into in this podcast all the time, where it started off being about social issues and the big sort of overarching social issues. So I think the overarching one for this would be, disability or accessibility. And then now we're like digging into those different components, but then there's components within those components. And it's sort of, you can really dig really deeply into these issues. And we haven't had a chance to do that yet. But I appreciate you taking the time to dig into autism as a kind of a broad topic today. And I like to end all of the episodes with the question, what can our audience do to help? Whether it's supporting autistic people, learning more, or challenging stigma as it relates to this issue. And maybe you've already answered this. You talked about how people need to be more neuroaffirming, but is there anything else you'd like to say with regard to how our audience can help?
Can I do a shameless book plug?
Oh, absolutely.
Okay, so to help, you need to go buy and read The Person Who Arrives by Dr. Leah Kelly. Just because it talks about literally everything that I was just talking about with you and then some in a very accessible book. And I think that if you are anybody who wants to know more about sort of disability, the educational system, being autistic, and how those things work together. Dr. Kelly was a teacher in Chilliwack for like the entire sort of period of her career, and then she's retired from that to become a doctor, and sort of works more in a consulting role now, and in education and training, and the book is just amazing. So, the reason I mentioned that book is because if people want to help, it's like almost literally anything that you want to do is going to be helpful. So, you and I, our circle started crossing paths because we were doing sort of counter advocacy against people who were against the SOGI curriculum, which sexuality and gender identity um, curriculum in BC.
Hmm.
And so, that actually crosses over with advocacy for autism, because people who are autistic are 7 times more likely to be trans. And they don't know why that is. They don't know if it is something like within us inherent when we were born alone, or if it's that, and because we are not um, as easily swayed by social pressures. So we might have already sort of just been disregarding social gender roles because we don't care about other people's like social gender roles. And so it's interesting research. So if you are somebody who's trying to support trans people, you're gonna end up sort of getting exposed to also supporting autistic people because the intersection of those two communities is large, the overlap. And so any sort of giving back, looking out for marginalized communities, or learning more about yourself is going to help right now. I would say, don't necessarily go and donate to like autism causes because a lot of them do not actually support people like directly. I'm much more of a mutual aid person. So it's like if you just happen to know an autistic person who is struggling and you're able to directly help them, that will go a lot further than, putting $20 into a charity that's going to take 10 of it, filter 4 into like a different nonprofit, and then maybe $1 of it is put into like having a sensory calmed area at a festival. Like it's just such a huge waste. Mutual aid, working directly with the organizations, volunteering for them, saying, "Hey, I want to volunteer by putting a sensory calmed area together," or not necessarily just sensory calmed. That's just an accessibility feature for me, but not everybody wants a sensory calmed area as their accommodation, but it's just one example. It as I said, just any type of giving back to your community right now is going to be helpful for sort of everybody who's in a position of being oppressed, and that will help autistic people in the long run for sure.
Wonderful. Well, thank you very much again for being on the podcast. This has been a social justice podcast. I'm your host, Nicola Spurling, and today I've been joined by Wendy Graves for a conversation on autism. You've been listening to a social justice podcast, an exploration of our world's social issues, brought to you by NES Design and Construction and hosted by Nicola Spurling on the traditional and unceded territories of the Kwikwetlem, Katzie, and Qayqayt peoples.